Perfect. Okay, great. So I'm very excited and honored to actually introduce you to Quinn. The Michigan Parkinson's Foundation has been quite fortunate to have her work with us as an intern for a few months. And Quinn is going to talk about Parkinson's tips and tricks to improve your daily activities. And I will just turn it over to her. And after her presentation is complete, we will come back on and answer any questions, as time allows. Forgive me, I failed to introduce you properly. So let me do that. So Quinn went to Michigan State University for her undergrad. She is from DeWitt, Michigan. Not to be confused with Dr. Leawitt. She currently is a third-year graduate student at the University of Michigan for occupational therapy. She's been involved in Parkinson's disease research for the past 3 years with several professors. Some of them you might know, Dr. Amy York and Dr. Jamie Haynes. Has been a caregiver for a family friend with Parkinson's disease, and is currently working on a capstone doctoral project at the Michigan Parkinson's Foundation. And really, Quinn is a fantastic addition. So I hope you enjoy this program, and I'll see you on the other end.
Thanks, Julia. All right, so let's just dive into it. Thank you so much, everyone, for being here today. The goals of this presentation are to help you understand what occupational therapy really is, explore how you can be safer and more effective in everyday occupations, provide you with resources to make your life easier, and answer any of your questions related to everyday difficulties that you may have. If you have common problems that you experience every day that I do not go over, make sure to write those down because we'll address those at the end of the presentation. Okay, so what is occupational therapy, also known as OT? We help individuals get back to independence in their daily lives. So for example, if you have an injury or a condition that may cause challenges that can range from mobility deficits to muscle weakness to cognitive changes, as well as changes in vision, sleep, and energy levels. So OT can help you in a variety of ways. We might help you adapt or modify what you're currently doing to make it a little bit easier. We can teach you strategies such as energy conservation. So work smarter, not harder. Provide guidance and teach you how to use adaptive equipment. I have quite a bit of adaptive equipment here today that I'm going to go over, including some canes, some walkers, utensils for eating, things like that. And we also do restorative approaches, so neuro rehab techniques to help restore some cognitive functioning or neural pathways, things like that. So what are occupations? They're washing your hands, going to the bathroom, making dinner, taking care of your pet, folding laundry, solving a puzzle, just these little things that you do out throughout your day. Those are all examples of occupations. So this is a big question, OT versus PT, which is physical therapy. What's the difference? I get this a lot. It makes sense because they're very similar and they're overlapping in some areas, but OT helps a person do things. So a physical therapist might help you get from your chair to the bathroom, but the OT is the one that really helps with the occupation of toileting. So toileting hygiene, how can we make this safer and easier for you during this process? So I hope that helps a little bit. And I really liked this visual. So it shows PT, OT, and speech, how they kind of overlap, but they all focus on different things at the same time. So let's do some breathing techniques and anxiety management. I got a couple of questions about this and they wanted me to include it in the presentation. So I wanted to start off with some pursed lip breathing. So for this, it's a simple yet powerful breathing technique, and it really helps you relax and regulate your breathing. When it's done properly, it can improve your gas exchange in your lungs, decrease shortness of breath, really slow down your breathing rate, and improve your oxygen levels. So to do this, you take a really slow, deep breath through your nose. And then you purse your lips like you're blowing out a birthday candle. And you exhale through your mouth. So I'll count while you try this. We're gonna go in for 2 through your nose. 1, 2. Pucker those lips, out for 3. 1, 2, 3. So let's do that again. Inhale. 1, 2. And out for 3. 1, 2, 3. So you can repeat this pattern for 3 to 5 breaths, or as long as it feels comfortable and you feel a little bit more relaxed. But just remember that your exhale should always be longer than your inhale. This is another one that can really help relax, and it's an anti-anxiety strategy. So I wanted to try number 2 with you guys. This is called progressive muscle relaxation, and it helps break the cycle of pain caused by muscle stress. So it basically works by tensing up the muscle and then relaxing the muscle, because it gives a signal to the brain that this is the difference between the 2 states of the muscle. So let's try number 2, where you scrunch up your face. Don't worry about being cute. Scrunch up your face, squeeze your eyeballs, scrunch up your nose. Your upper lip should be coming up, and hold that for 5, 4, 3, 2, 1, and relax. So you should really feel the difference. Let's try that one more time. Scrunch your face up, bring that nose up, squeeze those eyeballs. And 5, 4, 3, 2, 1, and relax. So when you're maybe exhibiting some of those masked face tendencies that some of us do with Parkinson's, this one could really help your brain know the difference between relaxing and expressing via your face. Okay, let's move on here. So we have ADLs, also known as activities of daily living. So those are examples like we previously talked about with occupations, toileting, showering, things like that. Many people with Parkinson's can be independent in their ADLs, but the symptoms of Parkinson's, such as tremor, stiffness, slow movement, or balance problems, may make it more difficult to do daily tasks. So let's get into it and start talking about some of these. So first off, the shower is one of the areas of the home with a really high risk of falling. The shower can affect your endurance and your blood pressure. Simply sitting down to shower can make a world of difference. So I always recommend a shower chair to almost every patient I see, where balance, coordination, endurance, or almost any other physical limitation is a concern. Shower chairs are really solid supports while giving you a backrest. And this way you can shower in a safe way while still completing the task, and you can really conserve your energy for things that you want to do throughout the day that are more meaningful. The best time to shower is in the morning when you have the most energy, and 20 to 45 minutes after you take your medication. So your carbidopa, levodopa, your sediment. As for drying off, some people think it's easier to use several smaller towels instead of one big, large, heavy towel. Also, many people find pump soap easier to use rather than bar soap, because the bar soap may get slippery, falls on the floor. Oh yeah, I did add this picture in. So this is a solution. If you still want to use your bar soap, you can get a full-length nylon stocking and tie the stocking to the shower handle, so then the bar soap won't fall when it's dropped. Another option is to install some shelving here, and it's typically best if you install somewhere between your shoulder and your hip height, so that way it's easy to grab and you're not bending down and you're conserving energy that way. And I do want to say that I tried to put the pricing on a lot of these things because they do range quite a bit. But this is a tub bench. So if you have a walk-in shower, you would want the shower chair. But if you have a tub shower, you would want this tub bench. So it fills the same role as a shower chair, but it's designed to avoid the large hurdle of stepping over the tub. And the bench is designed to be wide enough to have 2 legs inside the tub and 2 legs outside of the tub. So you basically just sit down like this, and then you want to pivot 1 foot over the other foot over that big ledge, and then you can scooch on over. Okay. So the next thing I wanted to talk about is the grab bars. These are a really huge benefit for anyone who will be needing some extra support in the long term. They're the most secure and often the most helpful adaptation that can be made in the bathroom, both around the toilet and the shower. We typically recommend 2 handrails or grab bars to hold on to as you get into and out of the shower. The suction cupped or other removable grab bars are really not recommended. I've had a lot of patients that have used those and ended up falling because they don't stick very well. The basic grab bar comes in 2 diameters, and that's what you see here on your left side. And then the flip down bar typically goes on the wall behind the toilet. So you can see in the middle, there's another visual of the flip down bar on either side of the toilet, and that works really well if you don't have a home right there or a wall right there to install a grab bar. The last is the pull grab bar, and this can be placed at any point with a clear path from the floor to the ceiling. So it's secured by tension, and it's a really good solution for mobile homes or renters where permanent installment to a wall poses a problem. A handheld shower head is typically a very easily installed solution that gives you much more control over your bathing experience. Not to mention better hygiene. And then we have long-handled sponges. So as you can see, she's sitting, yet she can still reach and wash her feet around your back, things like that. Some people like the wooden handle brush a little bit better because it's just a little bit more sturdy and it does the same job. A non-slip mat is also useful in the shower as the floor is slippery and wet. If this is too large, you can always cut it in half and only use half of it. You can kind of mold it to the shape of your shower, which is really nice. But every so often, a proper shower or bath just isn't in the cards. So this first item here is bed bath wipes, and you may use this short-term or long-term use. Another option is to get a pail or bucket of soap and water and washcloths, and you can do a sponge bath this way too. Here's no rinse shampoo. So this is an option for someone who can't make it to the bath or shower easily. Another solution is some people just wash their hair in their kitchen sink, and that's easy for some people. So maybe you're doing the no rinse shampoo every other day instead of every day trying to shower. Okay, so adaptive aids. I'm talking about adaptive equipment and aids a lot, but what exactly are they? They're just items that help you stay as independent as possible for as long as possible. So they make your daily life easier and ultimately safer. Does insurance pay for these adaptive aids? That's a really common question. Generally, Medicare will pay for a new walker about every 5 years. In some cases, they'll cover bedside commodes, canes, scooters, or wheelchairs. But unfortunately, a lot of adaptive equipment, such as bathroom equipment, are not covered. So what if you can't afford to pay for these adaptive aids that you want or that you need? So there's a lot of local organizations that give this equipment away for free. And I'll just show you one of those resources. So it's called Great Lakes Loan Closet. You can just type that in your search browser and it should come up. So it's called Great Lakes Loan Closet. So when I typed it in Google, the first link that pops up, it says Great Lakes Loan Closets. That's it. So click on that link. And then you scroll down and it will say your state. So click on Michigan if you're here in Michigan. And then the next step right next to that is your county. I clicked Oakland. I live in Oakland County, and Michigan Parkinson headquarters are here too. So I figured I'd do Oakland. And then you just hit search, that button right next to it. And then all these different resources pop up. So this is the first one that popped up, and it says equipment available, wheelchairs, walkers, canes, shower chairs, bedside commodes, and sometimes there's more than what they even list. You call the number that's listed there, and it also has the hours they're open, and they'll tell you what devices they have available. and you just go in and you pick it up and it's for free. You can see the lending period is different. This one's 3 months, but a lot seem to be 12 months or as needed, as you need it. And I do want to mention, I'm going through this material kind of quick, but we are planning on recording this and putting it on YouTube, so you can always reference it back, press pause and go through it at your pace too. So moving on to grooming. Symptoms of Parkinson's, such as rigidity and tremor, can make it difficult to handle toothbrushes, razors, and hair dryers. So here's some tips to help. Energy conservation again, sit while you do these things to prevent falls and conserve your energy. So you could sit on a shower chair or a bedside commode, or any other chair that you bring in the bathroom could work. Also, resting your elbows on the vanity or sink may steady your movements and reduce that tremor. You can use an electric shaver to avoid getting cuts, and an electric toothbrush for better oral hygiene. You can mount your hair dryer on a vanity and utilize a hands-free option as well. Those are sold for a pretty cheap price. And then I always recommend to my patients to cut your nails right after you bathe, as your nails will be less brittle and easier to cut. And I found they don't fling around as much, but that's just me. Okay, moving on to toileting. So aging with Parkinson's disease can affect your ability to control your bladder. So urinary frequency and urgency are common problems. Frequency is the need to empty the bladder often, whereas urgency is the feeling of the immediate need to urinate. So you got to go right this second. If you have new urgency, frequency, or burning pain with urination, these could be signs of a urinary tract infection, also known as a UTI. So make sure to consult your healthcare provider if this is the case for you right now. As for wiping, ideally, you want to reach around your body, behind to your back and through your legs to wipe. Females, if you are wiping from front to back for bowel movements, you can do that. Just don't wipe from back to front, because that's bacteria and contamination, which can lead to a UTI. So always, no matter if you're going in front or back is recommended, but even if you're going in front, make sure to go from front to back and release the toilet paper that way. So scheduling fluid intake and bathroom breaks are a few ways to simplify things, as well as a toileting schedule. So let me give you an example of this. The first step in a toileting schedule is to create a toileting diary of when you go, and you do this for 2 or 3 days. Then your occupational therapist will find the common trends. Maybe it's before meals, typically, after meals, every 2 hours. And once the trends are found, then the OT comes up with the schedule. So the OT will create and print the schedule out for you. And then each time you go on the schedule, you can sign your name, so that way you don't forget that you went. This can help you avoid incontinence episodes, because example, you're going every 2-ish hours, but you're having some accidents. Maybe the new schedule allows you to go every an hour and a half. So then you avoid all those little accidents you used to be having. And you ultimately end up training your bladder when to go to the bathroom. And it works really well for some people. I always recommend keeping a night light in the bathroom, so there's always some light, especially when you're getting up in the middle of the night. Another strategy is try to double void. This basically means you go to the bathroom, you think you're done, you get up. Instead of doing that, you go to the bathroom, you wait there for a little bit, and then maybe you try again. Make sure all your bladder is emptied, and then you get up and move on with your day. At night, men can use a portable urinal. Both men and women can use a bedpan for a bowel movement, or you can get a bedside commode if getting out of the bed in the middle of the night is too difficult. Or even during the day, if it's too difficult, maybe you have the bedside commode right next to your sofa chair. And you just do a simple pivot squat transfer, and you're there in the commode, and you can go to the bathroom. The toilet is generally the lowest surface in your home, and your back, hip, or knee problems, or just general mobility problems may make it difficult getting on or off a low toilet. So a toilet riser is a great option. It's pretty affordable. And as far as design is concerned, toilet risers with armrests or handles built in are not recommended because people push off one side and it gets really unsafe really quick. On your left side, you'll see the bolted toilet riser, and there are two different designs. There's one for a standard toilet and one for an elongated toilet. So make sure you take this into account if you're getting one. These are really easy to install. You just unscrew your toilet seat and then you bolt the seat and the riser together. Just this time you're putting in the longer bolts provided. And this really helps with your balance and stability, and it's comfortable because you're still sitting on your own toilet, but you're just 3.5 inches higher. There's also an unbolted toilet riser, which you see on the right. This one's more affordable, but it does not bolt in. So some people complain it doesn't fit well or it feels unstable. So I always recommend the bolted if possible. If you have concerns about sitting balance or difficulty lifting and lowering to and from the toilet, some extra handholds can go a long way to decreasing reliance on caregivers. So a toilet safety frame is a really good option for people who want to minimize permanent alterations to their home, like installing those grab bars that we talked about. This might include apartment dwellers, renters, or people that just don't want to do anything for the installation fees or something like that. The bolted option can be adjusted and it has good stability, whereas the freestanding frame is also very steady, but some toilets are not quite set up to use this type of frame. For that reason, I always recommend the bolted frame, and it is a little bit more common. Toilet aids are designed to assist people who have difficulty with toileting hygiene. So these are often beneficial for people who are having difficulty reaching to clean themselves. So both the toilet tongs and ejector wand, you basically put the toilet paper in the most proximal part of the tool, and then you use that to wipe, and you just move around, but you don't have to reach as far back. Bidets can be a game changer for people who have difficulty with hygiene. They come in a variety of features, but they all cleanse you with water, meaning that you can reduce or entirely eliminate the need to wipe manually. This purple one, the portable bidet, you can leave it at home with you or it can come with you in a bag. But the downside is you need to reach close enough to your behind and then squeeze it. The next model is also affordable, and it's a really well-liked bidet. You can select between single and dual nozzle. These models fit with any toilet and they install under your current toilet seat, and they're pretty compatible. So let's move on. Here's some of the more advanced bidets. And you might consider this because you want the hot water as well as the cold water. So this one is a dual nozzle, and it comes with a hose that hooks up to the hot water. But again, you will have to air dry or use toilet paper. So if you have difficulty wiping, I would suggest the model on the right. The dryer models include a air dryer, a seat warmer, and an oscillating spray to allow for better cleansing despite difficulty easily weight shifting on the toilet. Basically, the more expensive you go with these bidets, the quicker you're going to be able to dry. I'll just briefly mention these are the 4 main types of bedside commodes. And the reason for the drop arm is if you're doing a slide board transfer, you'd want to do one of the 2 drop arm options here. Okay, and then there's some other tools. We have underpads that keep the mattress, bedding, and furniture clean and stain-free when it comes to incontinence. So the first set of underpads here, you just dispose after use. There's briefs that can be pretty thick, or there's underwear that's thinner and it just has a thin pad in it, and you just dispose after use. And then there's reusable underpads if you want to just wash that after use. This is mainly for caregivers. Just allow plenty of time for your loved one to use the toilet. A simple bell option or having them call you could be an option if they need your help or when they're done with toileting. Allow for and respect the person's privacy as much as possible. Men can always urinate while sitting for increased safety. A lot of my patients do this because it makes them feel safer and there's no rush. They don't have to worry about getting tired or their balance. And also for men, an external condom catheters may be really helpful. So just something to consider. So I went over a lot of bathroom equipment. If I were to only recommend 2 things based on client feedback, I would say either a shower chair if you have a walk-in shower, or if you have a tub shower, I would recommend the tub transfer bench. So one of those 2, depending on which shower type you have. And then I'd also recommend the toilet safety frame. A lot of people love this and it makes them feel safer. Okay, let's move on to a different topic. So general eating tips: schedule meals during on periods, which is 20 to 45 minutes after your sediment. Cut food into small bite-sized pieces. Sit up as straight as possible when you're eating, as well as 30 minutes after the meal to help with digestion. Maybe you're doing something cognitively stimulating after, you're doing a crossword, you're reading, something after your meal that could be a good way to incorporate, working on your memory, attention, something like that. Never eat or drink while laying down if possible. So even if you're typically laying down, even a couple degrees forward will help with that digestion and lessen the risk of choking. If you have swallowing problems, avoid thin liquids or use a straw. So there is mixed research about straw use. It's very client specific, and I would ask your speech pathologist. And then again, refer to your speech pathologist if you have frequent coughing, choking, or difficulty swallowing. Okay, so I have some demonstrations for this one. Finally get to use some of this fun equipment. So for eating, ways to reduce your tremor, we have weighted silverware utensils. So these help dampen the amplitude of your tremor because of the weight. We have a whole box of these at Michigan Parkinson's Foundation. If you're interested, just come on in and pick them up. We also have some grippy silverware. We have spoons, forks, knives, all sorts of stuff. If you're interested in some of this adaptive gripping, we also have pens, toothbrushes. So just come on in and take a look if you're interested. A built-up handle, which is that second bullet point there, is basically a fat grip handle. So you don't have to hold the utensil with these muscles and squeeze it. It's a little bit easier on your hand, and your hand is it's less likely to fatigue because it doesn't have to be so grippy. So you're less likely to drop your utensil as well. Google is working on an adaptive utensil device. So when it's an electronic device that can dampen the tremor, but the algorithm still needs to be refined. And there's a clinical trial with Liftwear that has found that they reduce shaking by an average of 76%. So this is huge. This is awesome. There's also a wrist weight that some people really love to use, and that helps dampen the tremor while they're eating. There's also an insulated dish that keeps food at the right temperature for slower eaters. We have the high-low scoop plate, and that allows food from sliding off as you eat. So you can basically use the side to scoop items up onto your spoon, like those peas. We have the rocker knife. So this cuts meats and other foods with the simple rocking motion. Some people like using a pizza cutter as well. There's also easy to hold angled utensils that could make your mealtime easier, especially if you have visual, spatial, or depth perception difficulties. Noisy cups, which is the man drinking from the cup in that figure. These really help because it makes it easier to drink fluids without tipping the head back as far. We know that the chin tuck helps with swallowing. Do not try to overextend your neck while you're drinking or eating. And there's also spill-proof cups that won't leak if they're dropped or tilted too much. Okay, so there's a range of jar openers. I don't have time to go over them. But luckily for you, if you struggle in this area, there are so many options out there. I narrowed it down. That's what the arrow is pointing to. Those are the top contenders there. Another option is Dyson, which is this blue roll that you see here. Dicing is basically just a sticky material that can decrease the friction. So for example, you could buy a roll of Dicing, cut a little square out, put it at the bottom of your jar, set your jar on top of that, cut another little square out, put it at the top of your jar, and unscrew your jelly. And it works really well for a lot of people. Dicing can also be used for plates and other things too. But we also have, see, it's sticky. We also have some adaptive plates and bowls and things in here that already have the sticky material on it. So if you're interested, we have all sorts of stuff here at the clinic if you want to come in. And I should mention that the big box of adaptive equipment we have here, U of M students, occupational therapy students made all of this stuff for you guys. So they're happy to give it away. Okay, so this next one, Sialorrhea, also known as excessive drooling. It's a really unmet need that affect a lot of people with Parkinson's over the course of their disease. So drooling in Parkinson's occurs when there is excessive saliva in the mouth, which leaks out because they may not be aware that they're not swallowing as frequently enough, or they may be distracted from swallowing automatically. Excessive saliva can also occur in the throat, and it can lead to aspiration. So some solutions to this are chewing gum or sweets, because this tells your brain that you have something in your mouth, and it helps you swallow more automatically to reduce that saliva buildup, because it activates the automatic swallow reflex. Additionally, you can wear a sweatband on your wrist and just discreetly wipe off your drool, and no one will see it, I promise. If these lifestyle strategies aren't effective, then talk to your physicians, because they can help with medication adjustment, or they can do Botox injections that may help. They can also recommend you to an SLP or OT for a swallow study. Okay, going out to dinner, the big key here is just to plan ahead. So time your meal for when your medications are most effective. I know I keep saying that, but it's so true. Most people dine at 6 p.m., so maybe you're going an hour earlier, and you might have quicker seating and a faster food service overall. You can look online to see the menu. If it makes you feel more comfortable, you can pick out your meal before you even go to the restaurant. Maybe you write it down on a piece of paper so you don't forget, if that helps. Or maybe you see if they have accessible seating for your wheelchair if you use one. You can also go and sit down for a dining experience rather than buffet style, so you don't have to deal with multitasking, walking around, managing the plate. But I know it is kind of COVID time still, so just your preference on that. And you can bring your set of adaptive utensils. A lot of these aren't noticeable at all. You can't even tell that they're adaptive, but they really help people sometimes. And then someone brought this up to me. They use saran wrap when they drool. So you basically cut off a little square of saran wrap and you stick it on top of your clothes. The good thing is it's clear, so no one will notice, and your drool will just stick right to that and it won't get your clothes wet. So after you're eating, you just crumple that up, you're good to go. Nothing's on your shirt. It's beautiful. Okay, so medications. I mentioned this a lot. Typically, it takes 20 to 45 minutes to kick in. So plan to be active during this period, whether that's doing your ADLs or you're doing an exercise class. Pureed food such as applesauce sometimes help people swallow pills. It's just easier and they're less likely to choke rather than doing the liquids. You can ask your pharmacist for large print labels if you're having difficulty reading all the information on your medications. You can mark each pill bottle in distinctive ways to make them easier to identify, such as felt or Velcro. You can get a pill organizer, which is this colorful picture here. This is a monthly pill organizer, but they come in dailies and weeklies as well, and that really seems to help people. There's bubble packs, visual pill charts, also pill crushers. So if you don't like swallowing pills, you just use this. I wish I had one here to show you, but you crush your pill up and then you can just dissolve it in a liquid and drink it that way, and you have your medications that way. More medication reminders, there's a lot of them out there. A daily pill box reminder, which is this picture over here. It's really cool. It lights up the day of, or you could set it for, the next time you need to take meds, that can light up. And then it has an alarm clock, basically, that goes off every time you need to take your medications. But I always recommend either checking something off or signing your name on a slip, so you know that you took the medications at the appropriate time. And you don't forget that. There's also pillbox timers with time caps, the time cap and the bottle that come together, which is down here. And then you could set an alarm on your phone if you just need a simple reminder, okay, it's time to take my meds. As for getting dressed, allow yourself plenty of time. Hurrying can lead to freezing, stress, or frustration. You can also do a few stretching exercises before to warm up your muscles. Maybe you're doing that home exercise plan that we went over in the beginning. And then some energy saving shortcuts for dressing include gathering all of the clothes and accessories you need before you begin. So grab everything, go ahead and sit down. And then you want to dress your lower body first because it takes more energy than your upper body. You can bring your feet up to you rather than bending down because, again, that saves more energy. And you can also use a footstool for support if necessary. So choose clothing with fewer buttons and zippers if possible. But we also have solutions for that too. So almost anything nowadays, there's an adaptive device for. This is a button aid. It's magnetic. Let's see how smooth that can be. I'll demonstrate it for you guys. So yeah, buttons just like that, right over your buttons. So instead of buttoning up, if you want to wear a nice shirt, you can use this button aid, just magnetic. And you put it right over your button. You don't have to put your button in the hole and it will fasten it for you. They're just magnetic. But there's a lot of adaptive aids for buttons like this. You want to use pants with elastic waistbands, such as sweatpants, things like that. But you want to avoid pants with elastic ankle bands because those are hard to get over the feet. And same thing with socks. You want to avoid tight elastic bands with your socks. So you can replace buttons with Velcro or try magnetic buttons like I just showed you. In general, just try to wear loose fit clothing because it's going to be easier for you. If you sweat heavily, choose cotton or other natural fibers that breathe. And then non-skid socks are recommended over slippers because slippers do just that. They can slip off pretty easily. Whereas if you have the non-skid socks, those also have traction at the bottom, but those stay on your feet a little bit better. So I don't have time to go over the hip kit, but this is a really common bundle that people like to buy because it includes a lot dealing with dressing. So we have the shoe horn that helps you put on your shoes. We have the sock aid that helps you put on your socks. We have the dressing stick, helps with zippers, buttons. It can help grab your clothes so you don't have to get up. There's also the reacher, that sponge, the long-handled sponge that we talked about, and then elastic shoelaces that may help with tying your shoes. This is a memory aid for getting dressed. So I always recommend just keep it really simple with this. As you can see, a simple visual and then underwear, what it is. I know I could benefit from this, but you could really do this anywhere. You could do it in the bathroom, the kitchen, whatever you think would make life easier. As for functional mobility and changing positions, with Parkinson's, it's not unusual to have trouble turning over or getting in and out of bed. So if you have a lot of trouble with this, you might have to have your medications be adjusted, so talk to your healthcare provider. But a satin sheet or piece of satin material tucked across the middle of the bed can make it easier to turn over. Flannel sheets or heavy blankets on top of you make it more difficult to turn over, so those aren't recommended. Make sure the pathway from the bed to the bathroom is always well lit. And remember, use those night lights in the hallway. Maybe it's a closet door left open with the light on, whatever works for you. And then you can keep your morning meds on the nightstand, and you can take those before you get out of bed. Maybe you wait 20-ish minutes and you get out of bed, and it saves you a lot of frustration and stress. So I wanted to show you how you should get into bed. So you approach the bed as you would a chair. Let me lower this a little bit. There we go. And you slowly lower yourself into a seated position on the bed, using your arms to control eccentric lowering. Then you lean on your forearm, and it will allow your trunk to fall down. And then as you're falling down, your leg should want to swing up to the side. It's kind of like a seesaw. Never crawl into bed. Let me move this out of the way. So we never recommend crawling into bed or putting your knee first, because this can be really unstable and may cause a fall. Okay, getting out of bed, we call this log rolling. So you're laying flat in bed. You want to put your knees up, feet flat on the bed, and then you roll to your side towards the edge of the bed, and you let your knees fall. Reach across with your top arm, and then you lower your feet on the bed as you push up with this arm here into a sitting position. So it's really useful if you have a bed rail right here on the end, so you can just grab that and help pull yourself up. I think we got one more demonstration here. Okay, so rolling in bed, it's just as I described. So you bend your knees up, you let your knees fall to the side. As you roll, you turn your head and you reach with this arm. And then as for scooting, you keep your knees up, you push into bed with your feet and you lift your hips up, and then you shift your hips over in the desired direction and keep doing that. Okay. So bed canes or bed rails, like I just mentioned, provide a handhold assist with bed mobility. So you insert these between the mattress and the box spring of your bed, and then you use a safety strap which fastens around the box spring to add stability. Next, we have bed ladders. So these attach to the foot of the bed and provide a handhold to climb up with, and then this helps you getting up. So this is useful for people who have limited core strength or leg strength. If you're taking care of someone who can't get themselves out of bed or around the home without a lot of help, this may be your best solution. It's a lift. The big decision you need to make is between a hydraulic or an electrical lift. And then if you're getting out of bed, always have a phone or a medical alert device with you just in case something happens. They make all forms of this nowadays. You can mount something on a wall, just like your home phone, or you can wear a necklace that no one knows what it is, or a watch that looks like an Apple Watch or a Fitbit. Always, if you're moving from sitting to standing and you feel dizzy, this could be orthostatic hypotension. So you just want to sit down, practice that pursed lip breathing to increase oxygen, and maybe have your loved one get you some juice or food. Maybe you just need some nutrients in your system. So really think about the last time you ate. Maybe you need something in your system. Okay. So next we have canes. I have a couple here I can show you. So this is the single point cane. And this just helps increase stability and balance. Some people really like it. It's pretty light. And we also have another single point cane. If you guys can see, this one has a little guard here and just provides increased stability. So if you guys want to try out any of this equipment that we have here, you're more than welcome to stop by the office and try it out, and we'll teach you how it works, and any questions that you have, we can answer those in person. So you really want to avoid tripod or quad canes, which are the 3 or 4 point canes, because people with Parkinson's have trouble using these correctly. They're typically placed too close to the feet, where all points do not touch the floor at the same time. So a straight cane with a rubber tip is ideal. 4-post walkers should be avoided, but we do recommend the 4-wheeled walkers because they offer more stability and they're easier to turn with. Additionally, these types of walkers have built-in seats and baskets sometimes. So you can set things on them during transport, or you can always take a sitting rest break. Okay, so when in doubt, safety it out. Use an adaptive aid if it makes you feel safer. It's always recommended you be more safe if you feel unsteady or not balanced. Let me demonstrate some more of this stuff. So this is a U-step walker, which is what we recommend to people with Parkinson's. How it works is it has a really steady and heavy base, and you have to click one of these two or pull one of these two to go. So you can just do 1, or you can do 2. And then when you release this, it stops right away. And it also has this basket here. You can sit on it. You can store things in it. Also, if you want to load this in the car, it's pretty easy just to fold up. There we go. Little clip here. And you can just store it. So this is another similar walker. I wanted to show you guys this one, the up walker, because this helps people stay upright. And that's hence its name, the up walker. But this additional piece here can be put on the U-step, which is really cool. So if you feel like you're really slouched, and you can't stay upright, this could really help you. We also have this lightweight walker. So you can come in the office and try it out. Has some storage back here. It has a safety belt, but people use this when they travel and they just pack it in the car. It folds really easily. You can fold these down. And then you just grab the seat and it pulls right up. It's super light, guys. I'm not even kidding. So it's really nice if you're going out in the community and you just want this as a backup in case you get tired. You can bring that and it will easily fit in the car. Okay. So I might skip this part because we're getting a little short on time. But again, this will be on YouTube and you can always follow up and ask any questions about sit to stand tips, stand to sit, getting in and out of the car. So let's move on to exercise. Always plan during on times. It's always okay to adapt or modify the exercise if you feel safer. If you're doing an exercise and you feel safer sitting, that's fine. Just do the exercise from sitting. There's all sorts of options that demonstrate exercise routines, such as videotapes, DVDs, books. So there really is no excuse not to exercise. And exercise groups are encouraged for increased competitiveness, camaraderie, and socialization. So get yourself involved. And then leisure activities such as gardening, playing with children or pets, or walking are all options for movement and exercise. So vigorous cardiovascular exercise 3 to 4 times per week for about 30 minutes can help you fall asleep faster and sleep more restfully. There is wearables out there such as the Fitbit and the Apple Watch. So we always recommend, if your affected side with the resting tremor is on the right, to wear this on your left wrist, because sometimes the tremor will mess with the watch and it won't be as accurate. But during exercise, look at your heart rate and really focus on your intensity in raising your heart rate, because that's what matters. As you guys probably all know, exercise is critical for mitigating your symptoms, so it's really important. Social participation. Michigan Parkinson Foundation offers support groups all over Michigan, all sorts of exercise offered 6 days a week via Zoom. We have our YouTube page, respite care assistance for caregivers. And we also have special events like the walkathon, gala, and boat run, which are all found on our website. For leisure activities, we do have a ton of these card holders. It's basically a hands-free option for playing cards. And you just set it on the table and then you can play and you don't have to hold up your cards the entire time. We have a ton of these in the office. Come and get them. We also have more shoehorns as well as all the adaptive eating equipment. So living with low vision, a variety of eye conditions are common with older age, such as macular degeneration, glaucoma, diabetic retinopathy, and these all make it difficult to complete daily tasks. So I recommend maintaining good lighting in walkways, hallways, and stairwells to avoid potential hazards. Use low vision tools such as magnifiers, large print checks, or signature guides, which is what you see here. It's basically a black piece of plastic and it outlines the area where you sign, or maybe you use this during letters and you just keep moving it down so you stay within the boundary. Always remove clutter, cords, or throw rugs to avoid falls. Use high contrast when possible. So use dark colored grab bars if the wall is white, navy blue or black. Grab bars would be ideal in a all white bathroom. Use the microwave if you feel unsafe using the stove or the oven due to your vision. And then organize your bills and other important papers in different colored trays or folders with large labels. As for grocery shopping, consider using a delivery service. Nowadays, they can deliver right to your home, or you can go to the store and they'll come out and load it in your trunk for you. If you do plan on going into the store, bring a prepared list of what you need to buy, and then you can organize your list by the section of the store or the aisle. You can transport items in a cart rather than a basket, again, to conserve energy. And avoid going during busy hours when the store and streets are crowded. We're almost done here, guys. I know I'm flying through this, but we're kind of running out of time. So for handwriting, I always recommend a hand warm up. So you just lift your arm, spread your fingers. Some people call it the finger flick, just really warming up that hand. When you're writing, think big strokes. You can use lined paper or that signature guide, and that really seems to help people. You might need to vary the size, shape, or the weight of the pen, and you can try that out in the office here. Take breaks when your muscles fatigue. Maybe you're taking a little rest, coming back, doing a little warm up, and then starting again. Maybe you're changing your grip on your pen or you're trying an adaptive aid. So communication. I don't know if I have time to go over this, unfortunately, but there is an option that you can use your face to unlock your phone rather than entering in a code every time. And this will be in the slides for you to look at with step-by-step instructions. And then there's an accessibility feature on your phone if Tremor is impacting your ability to text and talk on the phone. Okay. So lastly, just having a daily routine is super important to combat boredom, anxiety, and provide stimulation to your brain. So tips for your routine: as able, have the same wake time and bedtime every day. Get up to the chair or the dinner table for each meal. If you can't get to a chair, just have someone help you sit more upright. Create a schedule for your day, including stretches, home exercise plan, MPF exercise courses, reading, watching TV, calling family. Just actively participate in self-care tasks as much as possible. Okay, here are my references, and then I'll take any questions.
Well, I just wanted to say, Quinn, thank you. I know that that was very comprehensive. When Quinn was working on this project, quite honestly, we could have probably made 3 different programs because there's so much information out there. So again, this will be up on our YouTube channel. But not only that, we welcome your tips and tricks. If there's something that you found that has worked well for you, we would like to know so we can share it with other people. If there's any questions, we can hang around for a few minutes, but I want to be very respectful of everyone's time as well. And you can unmute yourself if you have questions. Otherwise, you can leave the room and come back and see us next month.